Well, everybody in the cancer research community clearly recognizes the value of clinical trials evidence for translating research into practice. What's often less appreciated is the breadth of observational data that can complement this evidence and inform both our research and cancer care. In talking to a lot of the members of our research community, one thing that's become clear is that most investigators are aware of some of the observational data resources that we support that are currently available, but most people really are familiar with just a few of them. In addition, we've been adding to the armamentarium of observational data sources, disseminating them to the research community. So one of our motivations in putting together this report, which is really kind of a top-level summary of resources, it doesn't provide a lot of granular detail, is to give people a sense of what's available, but also to welcome input from the community about what needs to be built, what resources are missing. The types of data are so varied and the research needs are so diverse that clearly we can't support every kind of data source that someone might want. So we have to prioritize. There are a number of examples of this, both in terms of enhancements of current resources, but also the creation of new ones. So many people are familiar with the SEER registries, our cancer registry system, but they may not be familiar with the number of enhancements and the way that we've been growing the SEER program to make it more useful and relevant to all kinds of cancer research. Some of our observational data sources are ones that we've made a long-term ongoing commitment to. So the cancer registries are an example, or some of the epidemiological cohorts that we've supported for many years or even decades in some cases. In addition to the cancer registries, we have a number of observational data resources from surveys, but also from data collected by other federal agencies and data from other sources. Our focus has been to try to bring these data sources together, to link them in useful ways, and to make them more usable to the research community. This report also tries to give people a sense, not in great detail, but a sense of what this whole menu of possibilities is, so that either they or their postdoctoral fellows or graduate students have access to these and can fully utilize them, oftentimes to answer a research question that might be answered through an R01 grant, but maybe more cost effectively or more rapidly by using data that are already available. One of the other challenges that we welcome input on is what is NCI's appropriate niche within the larger context of observational data. We're really looking for things that NCI can uniquely do and kinds of data that meet unique needs of the cancer research community. So we want to be mindful of what other organizations are doing, about what other agencies are doing, what kinds of data that they're collecting, how we might work through partnerships, but especially what are the top priorities for cancer research in the observational data realm and how can we meet those needs.